Welcome to the Pet Professional Guild Pet First Aid Certification. This certification is actually in 3 parts. This is part 1 of 3. The presenter for this webinar is Bethany Jordan, and I'll hand over to Bethany in just a moment, and Bethany will introduce herself. As I said, there are 3 parts to this. In part 3, in the final slides of the film, you will find all the certification criteria. However, if you have any questions, feel free to contact me at admin@petprofessionalguild.com, or you can contact Bethany at bjordan@dogsmith.com. There are several other videos that you will have received when you registered for this webinar. All these videos have been used, cadaver dogs have been used for this. They were all donated in the name of education. So the owners of these dogs and the cat are actually very proud to know that their pets are now being used to help educate other pet professionals, which should hopefully prevent the loss or substantial damage to additional animals. So I'll now hand over to Bethany. Bethany, thank you so much for doing this for us. Off you go.
Thank you. Thank you for attending our webinar. I'm a certified veterinary technician, also a DogSmith certified dog trainer, and certified CPDT-KA. I've also am the franchise owner of the DogSmith Panhandle in Southern Alabama and a member of the Pet Professional Guild, which has made this possible. So thank you to them. We'll go into our presentation. So the goals of this webinar are to make sure that you understand your role in pet first aid, that you understand what pet first aid is and what it is not. It does have limitations. How to effectively and safely be a pet first aid responder, and to learn how to manage the most common pet emergencies until the pet is transferred to a veterinarian. And also in the last section we're going to talk about the latest recommendations on pet first aid and CPR. CPR specifically has all new recommendations as of last June, so we're going to talk about that. So this is part 1. As Nikki mentioned, it's in 3 parts. So we're going to talk about defining what exactly is first aid, how to perform basic assessments, and we're also going to talk about shock. So what is pet first aid? It is that aid or treatment that is strictly designed to be used on the scene at the time of the accident. It is only a bridge to stabilize that animal between the time that the accident took place and the time when it can receive professional treatment from an official veterinarian. In this presentation, there's a lot of information, and a little bit of knowledge can be dangerous. If any of the techniques that we talk about throughout all 3 parts is used inappropriately, such as to treat a long-term illness or injury, then it'll only make the problem worse, because the more you treat it improperly, the longer that animal suffers before it can get to a vet, and that problem can become so severe at that point that it can't be treated. So it's really important strictly to use it at the scene as a bridge until that animal can receive proper care. During emergency situations, the animal is going to be really frightened, potentially painful, which may result in aggression. We know these dogs, we know these animals most of the time. Most of the time they're part of our family, but in an emergency situation, chemical changes actually take place in the brain that put the animal into a state of fight or flight. And especially if that animal is injured, then they cannot escape. If you continue to approach them and treat them improperly, then it can result in a dangerous situation. So you want to make sure that you use proper precautions, not only for the animal but also for yourself. You want to move slowly. No benefit can come from just running in onto an animal. Talk to them, move really slowly throughout the process so that you're not being intrusive, or at least as little intrusive as possible. Always apply a muzzle before you attempt to handle these animals, because remember, the goal is to give them whatever treatment they need immediately and then get them to a vet. So you're talking about handling them to transport them. So you always want to apply a muzzle. The only exception to that is if the animal is choking or having difficulty breathing in any way. And in this first section, I'm going to show you exactly how to identify if an animal is having difficulty breathing. So there's a couple of ways to place an emergency muzzle. This is a diagram that is easily found on the internet, and I put it in here because it's not necessarily the most gentle or kind way that we can do something. So if you look at number 1, it has you tie a knot into the center of the bandage or rope material. That only functions to cause pain in the bottom of the jaw and make that animal more reluctant to open their mouth. So I don't think that that's really necessary. Number 2, it shows you placing the loop over the muzzle and then tying it behind the ears in number 3. If you put the muzzle on that way, when you go to tie it behind the ears, you'll actually come in contact with the eyes, and it can cause damage to the cornea of the eye. So, and not only that, it's more uncomfortable and more stressful for them. So we're going to show you a better way to do it. And here is a video. You can turn to video 1. You should have the link to that and watch that now. Okay, that should have given you enough time to watch the video. You can see the best way to do it is to actually make the knot and put it under the jaw and then behind the ears. And it's just a simple knot, and then you always want to tie a bow behind the ears. So now that you have the animal muzzled, you have to get them to the veterinarian. So again, it's really important. Move slowly, talk to them the whole time, try to be as least intrusive as possible. I found that it's really easy if you can just get a blanket, and if the dog's not lying down already, have them lie down. And then you put the blanket behind them. You can gently then transfer them onto that blanket, and then with 2 people, pull it tight and then lift. With large dogs, be really careful when you first lift it up off the ground, as sometimes they will panic because they're not used to that feeling of being lifted. Then once you have them in the air and you're talking to them, typically they relax. From there, it's really easy to slide it into the back seat of a car. It's also recommended that you use something like a piece of plywood or a firm surface in case there's any spinal damage, which you can definitely do. I've just found that it's kind of hard to get it into the back seat of small cars such as a Honda Civic. So a blanket can be very effective, and if you pull it tight, it can be fine for spinal injuries as well. Cats are a little bit more difficult than dogs. They kind of fly into that fight or flight mode really quickly. They have very efficient, sharp tools of their claws and their really sharp teeth, so it can be a challenge handling them, particularly in an emergency situation. So after being a tech for so long, this is a method that I kind of came up with on my own, where you use their scapula to help restrain them. You can also scruff them if necessary, but I find that that tends to make the situation worse. But if they're still struggling a lot with this technique, then you can by all means scruff them. So you can go to video 2 whenever you're ready. Okay? We're going to continue with basic assessment. And performing a basic assessment is something that can be very beneficial in not only an emergency situation, but also those situations where you know there's something not quite right with your animal and you're not sure if it's something that you can wait on or if they need to see a vet right away. So this will help you a lot. We're also going to work to maintain safety. So to do so, we're going to work in stages. There may be a problem if you may need to perform a basic assessment if you notice any vomiting and or diarrhea, anorexia, which is not wanting to eat, lethargy, any weakness while walking, or any other obvious signs of external injury such as bleeding, lacerations, or lameness. So as we talked about, you want to work in stages. So the reason for that is to maintain safety, ensure proficiency, and you can also do a really quick assessment of major body systems that can indicate the source of severity of the problem. So the more systematically that you perform any task, the more proficient you're going to be at it. When we first teach vet students how to do physical exams, we teach them nose to toes consistently every time. The more systematically you perform, the easier it is for you to go through it later on, and also the less likely you are to make mistakes. So you can get a really quick, thorough assessment of what the problem may be without causing unnecessary stress on the animal, and also having a complete understanding of what you need to do moving forward. So you want to practice, practice, practice this because you want that muscle memory to help you ensure proficiency. Also, if you know what is normal for your pet, you can very, very easily evaluate or more quickly pick up on what may be abnormal for them and when there may be a problem. So basic assessment stage 1 is breathing. So from a safe distance, you want to evaluate how that animal is breathing. If they're conscious, if they're up and walking around, and especially after an incidence of trauma, their mouth is going to be open, their tongue is going to be hanging out. Obviously, at that point, you know that they are breathing. So you can go ahead and take a look at their tongue since it's hanging out. What color is it? It should be pink. If it's anything that's blue, grayish, it may even be verge on purple, then you know that you're looking at a severe difficulty breathing because this animal is having a lack of oxygen. Also, you want to take a look and see how much effort they're putting into breathing. Are they really, really moving their abdomen and their muscles to force air in and out? Is their nose extended, their neck extended, just trying to get as much air into their trachea as possible? Because those are the typical symptoms of having difficulty breathing. You can get a respiratory rate if the animal is not panting. If they are panting, then you're not going to get accurate results with that. But if they're not, a normal respiratory rate for a dog is 15 to 30 breaths per minute, and a normal rate for a cat is 20 to 30 breaths per minute. Open mouth breathing is never normal in cats. They like to do things like throw clots to their lungs and things like that that are life-threatening. So if they're open mouth breathing, they need to get to a vet immediately. If it is a fast rate, even in the dog, it could indicate difficulty breathing, pain, or stress. Okay. We talked about color, we talked about effort to breathe. And also notice if there's any excessive noise associated, excluding, of course, normal panting. So here's a video of a dog having difficulty breathing. This dog is in an oxygen cage with a high oxygen saturation, which is the reason that it's not open mouth breathing. But what I want you to notice is that even though he's sitting down, his weight's distributed on his front legs, he's got his neck extended, his nose up in the air, and he's really trying hard to use those abdominal muscles to move air. So go ahead and click on the link to video 3 whenever you're ready. Okay? Here's another video explaining the basic assessment step of breathing. So you can go ahead and click on video 4. Basic assessment stage 2, we're going to look at mucous membranes. And by mucous membranes, I'm referring to the inside of this dog's mouth, or the pink part. The tongue, inside of the lips, inside of the cheeks, and also on the inside edge of the dog's eye, right in front of that gum. That's called the medial canthus. That's also a mucous membrane. It can sometimes be hard to evaluate, though, with dogs, especially dogs that are pigmented. So you want to take a look at the pink part of the mucous membranes. Again, you're going to look at color, especially if you're not sure what the problem may be. Because as we already talked about with difficulty breathing, you're going to see gray mucous membranes, possibly tinged to blue or purple. With liver failure, you can actually have yellow mucous membranes. With severe anemia, such as with shock that we're going to talk about, or after an incidence of trauma and you potentially have internal bleeding, they're going to be white. Anytime there's severe anemia, they're going to be white. So you do not want bright red mucous membranes. Bright red mucous membranes can indicate an earlier stage of shock or high blood pressure. Also the early stages of heat stroke, because that's one of the shock stages as well. While you're there, you want to go ahead and evaluate how sticky they are. Run your finger across them. Are they nice and moist, which they should be, or are they dry and tacky? Is your finger just kind of sticking in place? If so, then that may be a sign of dehydration. And then the next thing you're going to do is perform a capillary refill test. Now, to do a capillary refill test, again, we talked about what the mucous membranes are, and this is a really good example of this picture of the dog. On the inside of the mucous membranes, this dog has a lot of pigmentation, so you want to avoid those areas of pigmentation because obviously you can't get good results there. Also, if you look just above the gum line on this dog's teeth, you can see redness around all of his teeth. That's one of the early stages of dental disease. It's called gingivitis, or inflammation of the gum. If you try to get a capillary refill time right there, then you're actually going to end up with false results as well. So on this dog, I would go up on the lip where it's nice and pink. You want to put gentle pressure down with one finger and then release. When you first release, that tissue is going to be white, and then you want to count in seconds how many seconds it takes for that tissue to reperfuse or to come back to pink. Normal for a dog is 2 seconds. If it's too slow, it can indicate a prolonged stage of shock or low blood pressure due to a number of reasons. If it's really fast, then you could be looking at an earlier stage of shock, which we're going to talk about in a minute. So it's really important. You want to take a look at that. Ideal is 2 seconds. Stage 3 is evaluating the heart rate. So we started off at a distance. We safely evaluated from a distance, is the animal breathing? Then from there, we came in. If they weren't having breathing, then we could put the muzzle on. We can evaluate mucous membranes even if the muzzle was on. We've determined if they're pink, if they're pale, if they're potentially having problems breathing, or if they're in a stage of shock. And now we're going to talk about heart rate. Kind of wraps up your full body kind of assessment. So heart rate, ideally, you would try to find it by using the femoral artery in the back leg. The femoral artery is located like a finger's width behind the femur or the long bone in the back leg. You can put gentle pressure on that, and you count the beats for 15 seconds, and then you multiply that number by 4 to give you beats per minute. A normal heart rate for a dog is 60 to 160 beats per minute in medium to large dogs, and 180 to 220 beats per minute in small dogs and puppies. And the reason for that is the smaller the dog or the younger the dog, the faster their metabolism is, so therefore the faster their heart rate is going to be naturally. And then again, a normal heart rate for a cat is a maximum of 240. Cats are very unique animals. They get stressed at all and their heart rate just flies. It's not uncommon at all not to be able to count the beats because they're so fast. So again, fast heart rate could indicate shock, anemia, pain, or stress. A slow heart rate could indicate a very serious level of shock. And while you're there, you want to evaluate how easy is that pulse to feel. If it's bounding out of the skin where you can almost see it before you even feel it, then that could be an early indication of shock. It can also be high blood pressure due to another medical reason, so that's definitely abnormal. Or when you put your hand there, you can't even feel the pulse at all, and you're having a hard time finding it. Then that can be a later stage of shock where we're going to talk about in a minute. The body actually starts shutting down. So that's a very serious level. So here's a video showing you how to find the femoral artery and take the femoral pulse. So you can click on video 5 now. Stage 4, temperature. A thermometer is not the first thing that I reach for in an emergency situation because the animal is already stressed and the picture says it all. That is exit only as far as they're concerned, and it's just rude. It's not necessary to stress them any more than we have to. Of course, there are some exceptions to this, just such as heat stroke, but it's not something that definitely, like I said, it's not the first thing that I reach for. Okay? So always make sure you use a flexible rectal thermometer, no glass. There's been horror stories of glass thermometers being used and the animal jumps or moves suddenly and the thermometer breaks, causing serious health problems. So like I said, this could be helpful in cases of suspected heat stroke, or if you also have that animal that just isn't doing right, just been off for 24 hours and you're trying to figure out what's going on. At that point, if you see a high temperature, it could indicate fever due to infection, virus, something like that. Normal temperature for a dog or a cat is 99 degrees Fahrenheit to 102.5 degrees Fahrenheit. We talked about what it was if it was too high. Could be some form of infection or virus. Could also be stress. Again, the first thing in heat stroke, we want to evaluate temperature. But if it's too low, it's even more serious, where it's a serious level of shock and the body's starting to shut down. So again, we worked basic assessment. We work in stages to maintain safety. Stage 1 was our respiratory rate, respiratory effort. So from a distance, we evaluate, is the animal breathing? If they are, how much effort are they putting into it? And if they're not panting, we get a respiratory rate. Stage 2 then, we moved in closer. We took a capillary refill time. We evaluated hydration and also mucous membrane color. Stage 3, we took a heart rate and pulse strength. And stage 4, if necessary, take a temperature. So now we're going to talk about shock and what is it. It's really popular in the movies. You hear a lot of the time they have shock and then they put a blanket on them and it makes everything better. But it's a little bit more complicated than that. If you think of the body as a very efficient machine, we've been adapting for a long time to get it right. So ultimately, our body as a machine wants to live. And whenever there's a problem, we have backup plans ingrained into our system to try to compensate for the problem, ultimately just trying to preserve life. So by definition, it's perfusion failure and impaired delivery of oxygen to tissues. And essentially what that means is that the organs and tissues that we need to maintain life aren't getting what they need in order to be able to function. So that can be caused by increased demands, such as vomiting and diarrhea, and then potentially not getting enough fluids. It can be caused by impaired oxygen delivery, such as respiratory distress, or both. And with the early stages of shock, as it progresses, can move through the different levels very quickly, and you can have organ failure and death pretty quickly resulting from it. So in the early stages, it's really important that we pick up on the signs of the early stages in order to save our animals. So in the early stages, basically the body says, okay, red flag, we have a problem, and then it shifts into high gear and tries to overcompensate for whatever that problem may be. So what do you see with that? You see the increased heart rate, you see increased respiratory rate, you see that rapid capillary refill time, 1 second or maybe even less. You have really injected or red mucous membranes and increased pulse pressure. This is where you go to feel that femoral pulse and you can almost see it before you feel it. Because the body, remember, the body is shifting into high gear to try to overcompensate for whatever the problem may be. And these are the signs that are frequently missed. And as it goes into a more prolonged stage of shock, then it becomes life-threatening very quickly. So if that doesn't work, then the body says, okay, our first backup plan didn't work. So now it actually starts diverting blood flow from the less essential organs such as liver or kidneys, ultimately to give it to the heart and the brain, just trying to preserve life. So unfortunately, we cannot live without a liver or kidneys anyway. So this prolonged lack of oxygen to the tissues then leads to the heart, because the heart cannot function hard enough, the heart cannot work hard enough to pump what little there is to the body, and then you go into a terminal stage of shock. So the clinical signs of a more progressed stage of shock, now you have that rapid heart rate still because it's trying to overcompensate and pump out what little bit of oxygen may still be circulating in the bloodstream. But now you're seeing the blood pressure drop. So you have weak pulses. You start to see prolonged capillary refill time, 3-4 seconds. The mucous membranes start turning pale instead of bright red. And then you start seeing the hypothermia. So low body temperature, as we talked about, is a big indication of the body starting to shut down. Then you start to see extreme lethargy, loss of consciousness, and then death follows that really quickly. So what causes shock? Well, a lot of things cause shock. Any form of blunt trauma, bleeding, internally or externally if it's a major blood vessel, dehydration, heat stroke, and venomation, which is toxic venom from any insect or reptile that may be toxic. Anaphylaxis, which is a severe allergic reaction. Humans can have that as well, where the body just goes into overdrive just from the exposure to something mild like a peanut in people. Or a severe form of infection, which is called sepsis. Essentially, that turns into a full body infection and the immune system just cannot handle it anymore. So this is the end of part 1. Please continue with part 2, where we're going to discuss a number of common emergencies that you may encounter.